Hello, Rachel from Speech Parent here. I had the privilege yesterday of meeting with some midwives. Now, we were talking about babies and those critical few weeks of life and how important it is to get feeding right early. Now, it's really interesting, but one of the midwives actually said to me, she said, "You know what, you speech pathologists, you've named yourselves wrong." She said, "It doesn't describe what you actually do." And it really made me think, you know, there's so much to speech pathology and speech therapy that people don't realise. And there's a lot of interplay between other professions as well, and a little bit of overlap at times. So what I thought I would explain to you today is a little bit about the role of the speech pathologist for a child with feeding difficulties, particularly for little bubs. Now, one of the most common involvement that we have with little babies is premature babies, so babies that are born before their due date. A speech pathologist can help to establish suck feeding in the early days and to make sure that the child has the right structures in place, but also that they're able to use them functionally for successful feeding. So the things to look out for are things like how well they're sucking, swallowing and breathing in coordination with each other, how strong their suck is, whether their oral muscles are working in the right way, and whether their oral structures are intact. For example, if they have a cleft palate or if they've got any malformation of their palate. Sometimes their palates can be quite high and arched and things like that. So there's lots and lots of aspects with little bubs learning to feed that a speech pathologist can help with. Often mums are referred on to a lactation consultant, and that's really useful, but a lactation consultant is primarily there to help the mum's experience with feeding. They'll look at bub and they'll try to get the good attachment and make sure mum's positioning baby correctly, etc. But their primary perspective is from the mum's perspective of how do you get feeding working from the mum's perspective. As a speech pathologist, we actually come from the baby's perspective and actually look at how do we get feeding happening effectively for the baby. And so we look at the baby's structure and function in order to be able to work that out. So there you go, that's what a speech pathologist does with little babies who have trouble with feeding. Talk, eat, play and learn.